Welcome back to the Pelvic Health Summit. I'm here with Brittany Crosby, a STOT certified Pilates instructor who is also the founder of the Co Pilates that has 2 locations in Manhattan. Welcome.
Thank you.
So tell us about Pilates. What is it and how can it be helpful for people suffering from pelvic pain?
Yeah, great question. So Pilates in general is a mindful movement practice. It comes along with equipment. You can either do it with that equipment or without it, but the basic breakdown is that it's a way in which to train your body to work from the inside out. So the stronger your core muscles are, core being the word that people most associate with Pilates. So the stronger your center is, the more efficient and stable your movement will be, and then that efficiency and stability travels out into your periphery. So the thing that I really wanted to highlight for the summit was this idea of the word or the idea of core being connected with Pilates. So most people, when they think of Pilates, they think, oh, strong core, you work on your core a lot in Pilates. And they associate the word core with abdominals, which is true, but there are other aspects of the core, there are other parts of the core, and the pelvic floor is part of that. So the pelvis is a stable keystone part of your body, and the pelvic floor is it's bony, built up of bony parts, but there's also a lot of muscle in there. Really small muscles, and those muscles have to be used, strengthened, and stretched, just like any other muscle in your body. So Pilates helps get in touch with those, be a little bit more understanding about where they are and what they feel like and what they do, so you can strengthen them and also relax them if that's necessary.
Awesome. So what can a patient expect when they come to see you in your practice?
So anyone coming to me would go through an introductory session. That introductory session consists of a health questionnaire that we go through with them. If they're referred to us by one of their practitioners, a doctor, a massage therapist, or a acupuncturist, and any other healthcare practitioner, we would have already spoken with that practitioner, so we'd have some background about what that practitioner is doing with the client. So we would talk about why they're coming to see us. In this case, pelvic floor issues, let's say. We would go through their health and movement history background, and then we'd go on to a postural analysis and movement analysis, just trying to get a baseline for us to measure progress against. And then the rest of the time would be spent introducing Pilates if they'd never done it before, or getting reacquainted with it if they have done it before, but also combining in the goals that they have for starting a Pilates program and or the issues that they're trying to address with Pilates. So that's what a first introductory session would look like. And then from there, they have the option to begin a program based on what works best for them and what they want to achieve.
What's something that you wish all of your clients knew going in about Pilates that would kind of prime them for the experience and also increase their results?
So I think especially here in New York, though not applicable everywhere, but I think everyone wants results really fast. And I think in the fitness industry, whether you're in New York or not, everyone desires results fast. And especially when it comes to things like issues with pelvic floor, pelvic pain, pelvic dysfunction, there's a certain amount of patience time that people have a hard time accepting. But you're learning a new skill, especially if you're learning to tap into muscles as deep as the pelvic floor. And if you've never done Pilates before, there's also learning a new skill, and that takes a little bit of time. And so I think if people really understood and were okay with giving their body some time to find a new way to move or to learn a new skill, I think that they would get excited about the smaller things that we end up discovering, rather than just needing the pain to go away or wanting to go back to where they were. Let's say example, like body back to the way it was before you had a baby, something like that. I think that would be something that if people really knew that and embodied it when they were coming in, I think that they would experience their results and their changes and their progression differently. And be appreciative of the phases that you have to go through sometimes.
Yeah, definitely. I actually have been working with Brittany as a Pilates instructor, and although there are goals and it takes time to reach them, the first thing that was the benefit for me was just more body awareness of where's the pain focused. So that was one benefit I experienced. Can you talk a little bit more about other benefits that people can achieve through Pilates?
Yeah, so I just want to elaborate on your awareness, the mention of awareness. So our bodies, our postures, they mimic how we move through life. And so we can get a lot done in an hour in a Pilates session, but that's let's say you're just going once a week, right? Which is better than nothing, but that's 1 hour out of how many hours in a week, in a day, in a week, in a month. And think about all the other things that you do with your life. How long are you at work? What are you doing with your body when you're at work? How do you move through your own home? Are you in your car a lot? There are all these things, and we're using our body all the time, and in using our body, sometimes we're not really using it, and we're definitely not focused on it. So gaining a certain amount of awareness in the mindful movement practice of Pilates, it stops us in our tracks every now and then, which is nice. So maybe you're standing at the counter doing dishes or cooking, and you realize that you're death gripping the sponge or the knife, or your shoulders are up into your ears, or you're leaning into one hip in the exact spot where you're having a lower back issue, or it's the SI joint that really bothers you. You then realize, oh, I'm feeding into this issue that I noticed, that I remember we were working on in the Pilates class that I took. So I think a big thing that really has a huge ripple effect into the rest of your life, that you could dedicate a certain amount of your time to Pilates and then be done taking Pilates, but you will always have a deeper amount of awareness in how you use your body when you're not in the studio, when you're not working out. That's really beneficial for a lifetime, and you can really evolve it based on where you are in your life, any injuries that you may have, new activities you may be picking up. The most exciting part for me is when clients come back to me and say that they have more awareness about certain activities. They've noticed that they are holding tension when they're driving their car, brushing their teeth, and they were able to make their bodies aware of that, release the tension, use their bodies differently, and it changed the pain in their neck or the aggravation in their back. I think that's a really big key thing that people can gain from a Pilates practice. Other benefits that are pretty noticeable pretty quickly: increased flexibility, increased stability. So let's say you're having some pelvic or hip issues, low back pain that's messing with your balance. That's really scary, especially in the winter when roads are, streets are icy. So it can improve your balance, flexibility, stability, and strength. Those are the three main things. So you get all of it in 1 hour.
And it's low impact.
Yeah, and it's low impact.
So can you tell us a little bit about the machines and the other tools you use in the studio?
Yeah, so you may see Pilates classes that are on mats, and I think sometimes that's why they get why Pilates can get compared to yoga. So there are some, they're both mindful movement practices. When you go to the machines, you can make an exercise that you might do on the mat harder, or you might be able to make it easier based on what the exercise is. All the machines are spring loaded, so those springs can either assist you or they can resist you. So you're helping to gain more mobility with the assistance and helping to gain more strength with the resistance. They're super fun. Nothing like exercising and doing really hard work while you're lying down. And the other fun part about it that I mentioned before is that practice and the machines can evolve with you as you move through your own process. So let's say you come to us with an injury or an issue that's really slowing you down. You've had to back off of all of the things that you usually do, and you're just trying to find homeostasis again. So we use the machines to meet you where you are there. Let's say you then start to gain benefit from the practice. You're gaining back your strength, you're gaining back your mobility, you're becoming more and more pain-free. Then we shift that practice with the machine's help into more of a workout, right? So it's not so rehabilitative anymore. We're being preventative, but we're starting to challenge you more, build more strength, and so on and so forth. Adding your activities back in, we manipulate the work again so that it makes you better at whatever activities that you're doing, running, playing tennis. So it's really malleable.
Awesome. Can you tell me a little bit more about the kinds of clients who come in to see you? What's their background?
So I love our studio because the spectrum's quite wide. I have women who use it as a supplemental workout to their running, other classes that they like to do, Soul Cycle. They don't really have any injuries, but they just really like it because it's making them better at all of the activities they like doing. And they occasionally, like I've mentioned, they've run into some injuries, so we've manipulated the work that we're doing to help them pass through the injury quicker and get right back on the bike, let's say. We have a handful of men of all ages who use it. Some of them, because men tend to be a little bit more inflexible, more so than women. So we have a lot of men coming in looking to gain more flexibility. And then, all the way up into men and women in their 70s and 80s who are just trying to stay active and, keeping themselves healthy after shoulder replacements, hip replacements, spinal fusions, breast cancer. So just continuing to move through all of those issues. We also see, in terms of pelvic health, we also see a lot of women who have just found out that they're pregnant, are midway through their pregnancy and postpartum. So all three of those stages have stages inside of them, and all of those stages require a slightly different approach, especially when it comes to pelvic strength, pelvic pain, pelvic dysfunction, depending on what the pregnancy was like and what the birth was like.
Awesome. For those people listening who are either pregnant or in postpartum, and some of them might be postpartum years but still experiencing pain, what can they look forward to in Pilates to kind of assist them with management of that pain?
Yeah, so especially postpartum, what I'm seeing from the women that I've had the pleasure of working with postpartum is being able to reconnect with an area of your body that isn't really totally yours anymore, wasn't yours for some time. You were sharing it. And it's different now. Some women may feel as though they can't quite connect into those deeper lower abdominal muscles and pelvic floor. They don't have as much control over it. They can't really feel it. If they've had C-sections, they might still be experiencing some issues with their scarring or numbness in the lower abdominal area. So what we focus on is trying to reignite or rebuild those neural pathways or find detours so that they can access those muscles, feel like they have some control over them again, and also feel more like themselves in their own body, because they have the ability to support their spines. They have the ability to use those muscles for exercise and feel fit inside their bodies again. So those are some of the things that I end up focusing on a lot with women who are postpartum.
Thank you. So for those of us at home who maybe are about to research where to find a Pilates instructor near them, what are some resources that you recommend?
Well, I'm obviously partial to the organization that I trained through, Stop Pilates, and they have an instructor master list. So if that's probably the first place that I would go, and you can just look up Stop Pilates and find an instructor who's certified through them in your area. If not, I would just see what's going on in your area by Googling private Pilates and do a little bit of research. So actually call and speak to the instructors or to the studio and give the information and ask the questions, especially if you were someone who's not just looking for a workout, but you're kind of in that post-rehabilitative area where maybe you still are dealing with some pain and not quite feeling confident about going back into exercise. You're feeling a little bit guarded about your movement. I would definitely do research by calling and talking to those instructors and asking questions to get the most out of your investment and working with an instructor one-on-one if that's what you choose to do.
Awesome. Do you have any self-care tips maybe around stretching or opening up the whole pelvic region, hip region that people can do at home?
Yeah, breathing. Oh my goodness. Breathing is one of the best ways to check in on what's going on through your spine and through your core, so through your abdominals and your hips and into your pelvic floor. Can we go through a little something? Mm-hmm. Okay, so we're gonna put our feet flat on the mat, or on the floor rather, occupational hazard. And you're gonna find your butt bones. Yeah, so you just wiggle around a little bit. Yeah, good. So often if we're trying to sit up really tall, we end up lifting our chest too much and maybe even leaning forward too much. So I would encourage you to rock yourself back a little bit so you feel like your weight is on your butt bones. And so I'm going to think about the pelvic floor like the easy way to think about it is a diamond. So you've got here, and if these are my, go ahead and you can make this shape with me too. Yeah. Your pointer fingers are your pubic bone. The corners here of your finger and your thumb are your sit bones, and your thumbs are your tailbone, right? And so again, for ease in explaining it and visualizing it, because Pilates uses a lot of visuals, everything here in the middle of this diamond is muscle, okay? And we can engage it and squeeze it. So just keep that diamond in mind. And so right now you're sitting on that diamond. And you're gonna take, if you wanna close your eyes, you can. We'll close our eyes. And you're gonna take a nice big inhale, drawing in as much air as you possibly can. And then as you exhale, you're gonna relax your chest, relax your neck. Good, and do it again. We're gonna think about the abdominals this time, so we're working our way from head to butt bones. And as you exhale, draw your belly button in. That's the easiest way to think about it. So we're trying to make our waist nice and narrow. Abs lifting up and in. Inhale again. This time, as you feel those abdominals engage, you're also going to think about gently squeezing your urinary control muscles. So the muscles that you would try and engage if you had to go to the bathroom but you didn't have any options. Nice big inhale. Exhale. Check in on your neck, head, and shoulders again. Try and relax any tension. We're going to go from top to bottom one more time. Exhale. Think about those abdominals wrapping in towards your spine, or thinking about belly button lifting up and in while your chest stays relaxed. One more time. Inhale. And as you exhale, feel that abdominal engagement, but also feel that little bit of lift in your diamond. And then relax. You can open up your eyes. Yeah. So in 6 breaths, we kind of went head, neck, and chest, abdominals, and then tapped into the pelvic floor right at the very end. So just at home, at your desk while you're driving, and if you're in the city while you're waiting on the subway, going through, if you thought about it in cycles of 3 breaths, that would be a great way to build some awareness, build some lung capacity, have a little bit of a chance to check in on tension, and then also build some abdominal and pelvic floor strength just by breathing and thinking about those abdominals, about those muscles, the abdominals and pelvic floor. You're creating awareness and strength at the same time by thinking about them while you engage them.
Awesome, thank you.
You're so welcome.
So tell us where we can find you.
You can find me on the web at www.thecopilates.com. We're also on Instagram and Facebook, The Co Pilates. And then in person, we have our main location in Manhattan and Union Square on 14th and Broadway, and we have a satellite location on 40th and Madison.
Thank you so much.
Thank you.
Thank you so much for joining us. Now I'd like to hear from you. Please share with us one takeaway from the interview in the comments below. Give us a like and share this group with someone who you think will benefit. Thank you.